I'm 17 years old, and Madison College is a great way for me to kickstart my career. I'm actually super excited that my classes are online. I really enjoy online learning. With the support you get from Madison College and your teachers, the teachers are still genuine. You still get their support through your emails. If you don't understand something, you just contact them, and they really help you out and support you.
Good afternoon, ladies and gentlemen. This is Robert Chappell, Executive Editor of Madison365, with your daily update of the news of the day, including the coronavirus numbers, which are not the numbers today aren't bad, but they're not particularly illustrative either. So I'll give you a bunch of numbers that even kind of in context don't tell us a lot, because there were just very few tests processed today, which is a little surprising. It's often the case that there are slightly fewer tests processed on a Monday or a Sunday, but it doesn't go down this much usually. So the bottom line right now is that only 5,900 tests were done. Yesterday was about 6,000. So the last couple days, the last 2 days really, we've processed as many tests as we should be doing every day. So yesterday, you might remember the positive test rate was 11.2%, which is really, really too high. Today, it's a little better. It's 7.6%, which means out of those 5,900 tests, we have 455 positive results, which is a low number of positive results. But that is only because we had such a low number of tests. We still have 7.6 of the tests come back positive, which is still too high. We really want that. If you're really suppressing the spread of the virus, that test rate should be about 3%. We should be testing a lot more people that are negative, and we should be getting a lot fewer positive results. So none of that is great. It's not bad. 455 is a lot, but it's not catastrophic. Our 7-day average of new cases is now 734. And the 14-day average is now 780. It was 800 yesterday. So having this day today where it's fewer than 500 positives actually pulls those averages down, which I guess looks good on the data. But we know that it's not. I mean, it's not that there are fewer people infected today. It's just that we're tested fewer people today, which means there's several hundred cases that have not yet been identified that could have been identified today. So that's the problem with that. The 7-day average of percentage is 7.67%. So it's just only slightly higher than the actual number today, which is slightly lower than it was yesterday. It was like 7.8 yesterday. We did have one more fatality today, and that's in Milwaukee County. The total death toll is now 1,039, and the number of people who have died of other causes after testing positive for coronavirus is still 18. So those 18 people, do appear in the positive test count, but not in the fatality count. Okay. Speaking of our positive test count, we are now at 66,196 over the past 6 months since this thing started in mid-March. Of those, 8,600 are considered active, meaning they're not recovered. Recovery, by the state definition, is that you've been either discharged from the hospital with mitigated symptoms, or you have documented lack of symptoms after having symptoms, or you were diagnosed more than 30 days ago. Sorry, I mumbled that. So that number is lower than it was yesterday by 100, which is good. We want to see that number keep going down. The one number that I'm going to tell you that really has me concerned is the rate of transmission. Now, we talk about this number every day, and that is the number of people who are infected by each infected person. It measures how quickly it's spreading in the population. If that number is 2, That means if I'm sick, I'm going to pass it on to 2 other people, and they'll pass it on to 2 other people, and each round of infection will be twice as big as the round before. If it's 1, each round of infection will be the same. Like I, as one person, will pass it on to one other person, who will pass it on to one other person, and it will continue to spread, but it won't spread any faster over time. If it's under 1, it'll actually spread slower over time, right? So we've been under 1 for a while. Until yesterday, we were over 1 for the first time, 1.02, I think. Today, we are at 1.11, which is bad. Again, it's not catastrophic. It's not 2. If we get past like 1.3 to 1.5, that's getting to be really dangerous. But 1.1 is bad. 1.11, which is where we are now, is actually the 4th highest of the states. I believe. I just want to check and make sure I'm right about that. It's 4th or 5th. Yeah, 4th highest. Hawaii is 1.22, Montana 1.12, South Dakota 1.12, Wisconsin 1.11. That's bad news. What that means is basically each person who's infected will, on average, pass it on to 1.11 other people. Easier way to think of that is if there's 100 people who are sick, those 100 people among them will pass it on to 111 more people. Not just 11 more people, 111 more people. So now you have 211 sick people. Excuse me. And then those 111 people will pass it on to 120 more people, roughly. So that's not good news. What that means is for the past 5 to 7 days, that's the data indicates that that's how it has been spreading. It's not necessarily predictive. It's more descriptive of what's been happening on the ground over the past 5 to 7 days, right? Okay, so that's not good news. We'll talk a little bit about some localities. Because we have such little data today, this is part of what's frustrating, is 455 positive results. You have some locations that have 10 or more cases in a county, but not a lot. You're just not catching a lot of cases when you only do 6,000 tests. But we can tell you, Dodge County, for example, has 12 new cases and 12% positive tests. So they're higher than the state average. Fond du Lac County, 28 new cases, 11.4% positive. Jefferson County, 14 new cases, 9.86% positive, so they're still higher than the state average. Oconto County, I'm not sure if this is entirely accurate, but they have 14 new cases. They did 14 tests, so they have a 100% positive rate. Oconto County being very rural, it's entirely possible that is actually accurate, that they only tested people who were showing symptoms or who had been exposed, especially on a Sunday, that they only maybe ran these tests on Thursday or Friday and just got processed on Sunday and Monday, but it was just a cluster of people who all had been exposed, so they all ended up being sick. It's also possible that they ran more tests and just haven't reported the negative results yet. So just keep that in mind. But still, even those 14 tests, even if they did that, even if they have negative tests that they haven't reported yet, it wouldn't be enough to meaningfully impact the statewide numbers. Racine County, 13 new cases, 50% positive tests. That's not good. Walworth County, 17 cases and 7.9% positive. Waukesha County continues to be a problem, 44 new cases, 9.2% positives. A couple other spots to make note of that have slightly lower percentages. 25 new cases here in Dane County. Most of them, almost all of them, below the age of 40, by the way. Only, I think, if I remember correctly today, there were only about 2 cases that were over the age of 40, and the rest of them were under 40. There were several cases of children, which is not great. Eau Claire County, 10 new cases, 5.4% positive. Kenosha County, 12 cases, 6.6% positive, so not terrible there. Outagamie County, 13 cases, 4.7% positive, not too bad. Rock County, 10 cases, 4.7% positive, also not too bad there in Rock County. Hospitalization, we didn't get any data over the weekend, but we did get data today. It's partial data, at least 365 people in the hospital today, which apparently, it's hard to verify this since we didn't get the number yesterday, but they're saying that that's 18 more than were in the hospital yesterday, but 49 fewer than it was a week ago. Remember, a week or so ago, it was hitting really high levels. It was over 400 not too long ago. So it's good that part is down, but it is still higher than it was yesterday. We have currently 124 people in intensive care units. Racial disparities continue to improve. About 12% of today's new positive cases are Latino. They make up only 7% of the state's population. So even in today's numbers, that 455 number, Latino people are about overrepresented by about double. But their total of the 66,000 cases total, they're about 22% Latino. That used to be like 33%. So the fact that it's only 3 times as likely for you to have COVID if you're Latino, instead of 4 times as likely or 5 times as likely, that's not great to say. It's improved all the way down to 22%. It's not good, but the fact is it has improved. Same thing for black folks. Black people make up 6% of the population. 14% of cases are black, and 20% of the deaths are black. So that's what I have for you on COVID. I'm going to take a couple of listener questions right now. Aaron asks, do establishments that close to test employees for COVID have to let health department know if they closed or if they had a positive? That's a good question. I don't think they do. I think the positive tests are reported to the county and to the state by whoever does the test. So the fact that a grocery store had a positive test, the grocery store would not have administered that test, right? So it would not necessarily be the grocery store's responsibility to report the test to the state. However, somebody did that test, either a doctor in a doctor's office or somebody at the community testing site, and that person, that doctor, that clinic, that hospital, that pop-up testing site would have reported that positive test. They would not necessarily have reported where that person works. And that would be part of the contact tracing process, I believe. I believe what would happen is that, if an employee at a store you mentioned test positive, that they would be isolate themselves. You would hope that that test result would be reported to the county health department, which would then report it to the state. And then a contact tracer will call that person and ask them, where do you work? Did you go to any parties? Did you go to any gatherings? Have you been to any large events? Have you been out of the state? Into a list of all the people who live within your household, that kind of stuff. So at that point, the county would become aware of where they work, but not for the purpose of shutting them down, but just for the purpose of calling their coworkers to say, we think you should get tested. Isn't it funny that I do this for a phone still? This is how you know I'm 46 years old. You do this for the phone instead of like this. Phones used to look like this. Anyway, sorry, back to your question. I don't think that a private business, in fact, I'm sure a private business does not have to report to the state that they have decided to close. They can do so. They can do so publicly. It's probably not a bad idea to do that publicly, but they don't have to. I'm pretty certain. Good question. Jen asks, any idea why the amount of tests has been so low? No. We have some theories. The thing is that it might be kind of thinking it might be partly due to the fact that some of the community testing sites aren't open on the weekends, but that these tests are still taking 3 to 7 days to process, right? So this 6,000 tests that we get today were actually processed, the swab was put in the person's nose last Wednesday. So I don't know why They're not. There might have been 12,000 tests performed on Wednesday, and we're only getting 6,000 of the results today. I don't know why that is. So the short answer to your question is no. We don't have any idea why the tests yesterday and today have been so low. We'll see if they catch up. It's possible that there was just a processing delay, and that tomorrow we'll have 20,000 tests because there's a bit of a backlog or something. But we will see. Thank you for your questions. Any other questions? Go ahead and drop them in the comments there. I'm going to talk about. Courtney, would you anticipate an uptick in Dane County following August 15th to 16th moving days? I don't want to predict that. I don't want to prognosticate too much, but I'm definitely holding my breath. I think I was actually on campus yesterday, just for a few minutes. No, Saturday. I'm sorry. I was on campus Saturday for a few minutes. And there were a lot of people moving in. And considering that, if you look at our most recent, not our most recent, our earlier versions of our coronavirus map for Dane County, that Langdon Street area, that campus area, was really the fastest growing area for coronavirus infection. So I would anticipate that there's some there that's recovered. Since then, the more than 30 days ago, it's more early summer. But I don't anticipate newly moved in college kids to wear their masks diligently. No shade to the young people. But I would imagine that there will be some, problems. Some young people who, coming from other areas that haven't been hit as much and don't think about it as much or whatever. I do know that you have people moving into dorms, which is different than apartments, obviously. But moving into dorms with people who aren't from their households, but not going to class yet, so they're kind of hanging around. I remember being a college kid for that first week or so that you're on campus but not going to school and kind of bumming around. I do anticipate, people not exactly following all the protocols on campus. Whether that translates to a big spike in cases 2 weeks from now, we'll see. I'll be curious also about the other campuses. I think it'll be just as fraught once people start moving into UW Oshkosh, UW Platteville, UW Milwaukee, etc. I think all those communities could be impacted. One other thing, George, thank you for dropping that link in there. This University of North Carolina was going to have in-person classes. Students started moving back in. 130 of them tested positive. They changed course and went all virtual. I don't know what it would take for UW to reverse course and go all virtual. I know that the plan right now is for a lot of classes to happen in person, for a lot of classes to happen in non-traditional locations so they can have smaller classes. But we will see. We will definitely keep an eye on it. We'll keep our fingers crossed, and we will definitely keep you all informed. One other thing I want to mention today is if you look at I think it might have slid off the front page by now because we had a few other news items come up. But if you, this morning, we launched our first ever list of Wisconsin's most influential Asian American leaders. This is something we've done every year for 5 years. I'm going to put the link in the comments. Just a couple months after we launched in 2015, we did our first Black Power list, which was the 28 most influential African American leaders in the state of Wisconsin, and it got a lot of attention. We've done ever since then. We did our first Latino list that next spring, and we've done Black and Latino lists every year since then. And a lot of times people have asked us, why don't you do other groups? Why don't you do Native Americans? Why don't you do Asian Americans? And the reason was we didn't have we didn't have really strong connections in those communities. We knew just our little group of founders was very embedded and connected to Black and Latino communities across Wisconsin. We knew some people who are of Asian descent or of indigenous people, but didn't have a real strong, authentic connection with those communities. And what we didn't want is for just us, our little staff of people, to decide, okay, here are your most important people. We really wanted these lists to come from those communities with our sort of oversight and with our sort of, authority and with our thought process as well. But we wanted the names primarily to come from those communities, and it took us about 5 years, honestly, to get that authentic relationship with those communities. So we're very happy that back in March, we were able to launch our first ever list of the 38 most influential Native Americans in Wisconsin. And today, we're just launching the first installment of the most influential Asian Americans in Wisconsin. Now, Asian American is a very broad term. Just like every other community of color, it's within that community, there's a lot of diversity. We have, obviously, Wisconsin with a big Hmong population. We have Chinese Americans, Japanese Americans, Indian Americans, South Asians, Filipinos, Pacific Islanders, wide range of people who are different cultures, different languages, different heritages. Some who've been who are third and fourth generation Asian Americans. Some who are children of immigrants. Some who are immigrants themselves. It's a real diverse and interesting group. The other thing is that we never limited ourselves to people who are just working within their ethnic group, right? We have people on our list this year who are like the president of the Hmong Chamber of Commerce, or who are working specifically in those communities. We also have people who run healthcare companies and who are bankers and attorneys, and who are representing the Asian American community, but in other areas that have like dual roles. So that's really important. So I mentioned it so that I hope you take a look at that. I hope you get to know those folks. A lot of them are people you might know. Some people you probably don't know most of them, but you should. We feel like you should. So we are presenting them to you. We're just introducing them, helping you get to know them, and we are today is just the first installment. There's going to be 49. The headline says 48, but it's wrong. There's actually 49. So there'll be 49 people. So today there's only 9. So if there's somebody on there that you think should be on there, don't get mad yet. Okay, wait. That person might be on a later day. If there's somebody on there that you think should be on there that's not on there, let us know. We're going to do this again next year. We do this every year, and we always feel like we're going to run out of people, but there are so many people of color doing really good and important work across Wisconsin. We always discover more. We always people introducing us to more people and more people. So it's really exciting to be able to do this in a new and authentic way. And we appreciate you taking a look and watch for those every morning this week. You'll get to know 9 or 10 more people that you probably didn't know before. So that's all I have for you today. I appreciate your attention. Enjoy the rest of your afternoon, and we'll see you again tomorrow.